Hi, welcome. I'm trying to learn medicine. Today, interventional cardiology. And after we've done that, we're going to do standing yoga. And if you participate in the standing yoga, that is at your own risk. Now, this is part 2 already. And we had that interventional cardiology is a branch of cardiology, so something which deals with heart diseases. And it is specifically focused on catheter-based treatment of structural heart diseases. Now, in the next part that we intended to read now carefully. Many procedures can be performed on the heart by catheterization. This most commonly involves the insertion of a sheath into the femoral artery, but in practice any large peripheral artery or vein, and cannulating the heart under X-ray visualization. Cannulating under X-ray visualization, most commonly fluoroscopy. So the X-ray is just used to see what is done by the cannulating. The radial artery may also be used for cannulation. Now we're talking now about the advantages. Now, what is catheterization? We're going to come later to that, what it is. It's not really here. I don't really get how it helps the heart if there's something done at the femoral artery or at the radial artery in the leg or in the arm. Is it pushed through from the femoral artery because we're using the large veins instead of it to the heart? I'm just wondering about it for quite some time. The radial artery may also be used for cannulation. This approach offers several advantages, including the accessibility of the artery in most patients. I think the radial artery is here. I don't know exactly, but it's the one where you can feel the pulse. There are several advantages, including the accessibility of the artery in most patients, the easy control of bleeding, even in... Okay, we're talking about diseases, cardiovascular diseases, the blood system now. Okay, easy control of bleeding, even in anticoagulant patients. I think anticoagulant patients are people who take medication to make the blood thinner. And yes, the bleeding is easy to control because the arm is closed, I think. And the enhancement of comfort because patients are capable of sitting up and walking immediately following the procedure. Okay, doing it at the arm, not at the leg. But the people can sit up immediately and walk after the procedure. And the near absence of clinically significant sequelae in patients with a normal Allen test. Whatever a sequelae is of the Allen test. Downsides to this approach includes spasm of the artery and pain. But isn't it logically that the same happens at the femoral artery? Spasms and pain, inability to use larger catheters needed in some procedures. So I think the radial artery is smaller than the femoral artery. So larger catheters don't work that good. And more radiation exposure. Why more? Because it is more difficult. The first idea is, and the one which I don't believe it is, because it is more difficult to work there and now it has to be done longer or whatever. And the second idea is because it's closer to the body. I would say so. And where does the radiation come from? From the X-ray visualization to see through the X-ray what is happening by the cannulating? Now, what is the fluoroscopy? But in recent times, a radial approach is getting popularity due to its patient comfort after procedure. Is it just about patient comfort, or I would add in this part, if it is about the patients can more or less immediately afterwards sit up and walk, then it's not just about comfort. But it is very helpful for the cardiovascular system that the people can exercise it or be active again. But I would add in this part that it is more than just about comfort. Because the downsides of spasms and pain also, that's also about comfort, inability to use larger catheters and radiation exposure, these are serious things. It's not about a little uncomfortness of not immediately able to walk and sit again. So we have to look at whether the information here is insufficient for proper medical outcomes. The main advantage of using the interventional cardiology or radiology approach are the avoidance of scars and pain. Now, why are scars and pain avoided? Maybe pain not from the operation, but afterwards. We're very at the beginning here. We're learning very at the beginning, so I think it's okay to speculate here, but this is not a medical lecture. We are clearly learning here. And we're doing it very openly. Scars and pain. Now, if it would be done at the heart, then the scars would be bigger. But is there really no scar at all? There can't be. And pain, is it afterwards pain? That could also be. And long post-operative recovery. Okay, that makes sense. To do an approach to operate something, to make something function again at the heart, then the recovery is shorter if operation was done at the arm or the leg. Additionally, interventional cardiology procedure of primary angioplasty is now the gold standard of care for an acute myocardial infarction. Okay, interventional cardiology procedure of primary angioplasty. Okay, angioplasty, where we have a picture here. Here's a coronary angiography and angioplasty in acute myocardial infarction. Angioplasty is a procedure, not the method of making this picture. That could be the method of making this picture could be X-ray or fluoroscopy, or yes, X-ray or fluoroscopy. Angioplasty seems to be the procedure, and that is now the gold standard for care of an acute myocardial infarction, so of a heart attack. It involves the extraction of clots from occluded coronary arteries and deployment. So clots are removed from occluded coronary arteries. Now, how is through an approach of radial or the femoral artery the removing of clots from occluded coronary arteries possible? And deployment of stents and balloons through a small hole made in a major artery, which has given it the name pinhole surgery, as opposed to keyhole surgery. Okay, it is used to get clots out. These seem to be something blocking. And deployment of stents and balloons. Stents are placed in there when holding the vessel open. And I just don't understand how balloons work. Are we just opening it up again? Are they staying in there? I don't get it. And again, we are openly learning. This is not a lecture video or an information video. We're openly learning. Okay, that is better. We are through with the introduction of a Wikipedia article. This is just a little broad overview. We will learn very much more. Now, that was it for now. If you work here for medicine or interventional cardiology, we will read on there. There's a bit more to the procedure. If you're here for interventional cardiology, you can go directly to the next part. We're going to do no standing yoga. If you participate in standing yoga, that is at your own risk. Bring the feet stand together, and we're doing the exercise. So bring the arms up. Down the arms up. And again, in the arms up. And out the arms down. And again, in the arms up. And out the arms down. And in the arms up. And out the arms down. Now bring in the arms up. And out the arms to the side. And the arms up again. And out over to the other side. In the arms up. Again in space between the toes and out over to the other side again. In the arms up. And out we're sinking down, arms over the side, down the arm, down into half chair. Breathing up again. And out on the one side. Breathe again in. And out again down into half chair. And up again. And out the arms down. We're leaning onto our knees. We're doing standing cat and cow. Breathe in. And out. Make a hill of the back. The cat. Again in into the middle. And out and making a round back. The cow. Again in. Out. The cat. Again in. And out the cow. Breathing in into the middle. And out we're coming up with a round back, making it a backward shoulder roll and lifting the arms up. We're breathing in and we're coming up with the tiptoes. We're reaching high. And out and we're sinking down into the chair. Breathing in and come up. And out again down. Again in and up. And out we're doing the down diving dolphin, the arms down, feet together, and just down. And we're doing a moment. Breathe in and bend the right leg. And breathe out and stretch the left leg. Again in and change. And out and stretch the right leg. Again in and change. And out and stretch the left leg. Again in and change. And out and stretch the right leg. Again in and change. And out both legs straight just down. We're doing the penguin. Breathe in and lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Again in and the arm down. And out and down, both legs straight. Breathe in and lift the left arm up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in and inhaling and down. And out and down. And we're doing the pelican. Make a hand with space between the toes. Shift the weight of the heels. And breathe in and come out. And out and up. Again in and out. And out and up. In and down. And out and up. Now we're doing the Chimashis counter pick. Take hold on the elbows and gently rock from side to side. And both hands again down. Close the feet, you're breathing in, coming halfway up into monkey half lift. And out and down again. Again in halfway up into monkey half lift. Out and down. And breathe in, we're doing the up diving swan. With the arms again up. And down. And we're doing the stretch of Venus. Make sure they're wide apart. Intertwine your fingers behind the back. Bring them over to one side. Tall up, breathe in. And out, look over to one side, to the side where the hands are. And out, bring the chin down to the clavicle. Now breathe in. And out, pull the shoulder down into the arm bend. Breathe again in, lift the gaze. Out into the middle. Bring the arms over. Breathe in. Hold up and look to the side. Bring your hands, bring the chin down to the clavicle. And breathe in. And out, pull the shoulder down and a bit in the arm. Again in, look up. Out into the middle. And now, feet are standing together. And we're doing the crab in the morning. Breathe in, shoulder, arms up. And out, chest to the sky. Breathing in, the arms up. And out again, the arms back and over, chest to the sky. Breathing in, the arms up. Now across the arms, intertwine the fingers, reach the front, hollow the back of the tray. Breathe in, the arms again. Out, we're doing the sky hugger, long arms down, chest to the sky. Breathe out, up across the arms, intertwine the fingers, reach high, breathe in. Out the arms in front, hollow the back, the right. Again in, the arms up. And the sky hugger, open the arms wide and over just the sky. In, the arms up and down. And a few eagle's wings, breathing and lifting the arms up. And out and the arms down. And the last time, breathe in, the arms up. Bring the hands to touch and lower the hands slowly down to heart center. That was the standing yoga. I thank you very much and until next time.